ONA worked to improve member services. It brought in malpractice insurance and the Legal Expenses Assistance Plan. And it introduced a voluntary benefits package for part-time nurses and retirees. As ONA added more services, head office grew too. By now, the union had a large professional staff. It was time to take the next step. ONA decided it needed to build its own head office.
We're on the corner of Grenville and Elizabeth, and the Doctors' College is on the corner of Elizabeth and College. And when we were being built, I got a phone call from the CEO there. Our building was going to be obstructing his view. It was going to be casting a shadow. I said to the builder, make sure you even put it a little higher.
Here we go. A little more than 10 years ago, the Ontario Nurses Association was a telephone on a corner of a desk and a small cabinet file in the office of the Director of Employment Relations of the RNAO. And a little more than 10 years later, we stand on this very auspicious occasion in a magnificent 7-story building. Our union has gone a long way.
ONA's efforts to give nurses a greater voice in the healthcare system finally paid off in 1989 with a major victory. The new Public Hospitals Act required hospitals to include nurses on major committees. The Wellesley and Toronto General Hospitals refused. ONA took them to court and won. ONA also had success in central bargaining. In 1988, a 3-year collective agreement with the Ontario Hospital Association was the first central agreement reached without arbitration. But the 90s were just around the corner. The decade started on a hopeful note with the election of a pro-union NDP government, a government sympathetic to pay equity. In the hospital sector, ONA negotiated another 30% increase, recognition that nurses had been underpaid. For hospital nurses, the pay equity issue was finally resolved with a settlement in 1993, ending 5 years of intense negotiations. It would take another decade to finalize pay equity settlements in other sectors. And in 1991, central bargaining also became a reality in the nursing home sector. But the joy didn't last. In 1993, ONA joined with other public sector unions to fight against the concessions of the social contract. That alliance laid the groundwork for closer ties with other organizations. One positive result of the social contract was that ONA won more control over the hospital workers' pension plan. Also, the early 90s saw ONA change its constitution to include allied healthcare workers in its membership. Then, at Queen's Park, things went from bad to worse. The Conservative government of Mike Harris was elected in 1995. The new government closed and merged hospitals. They eliminated thousands of nursing jobs.
Just as hula hoops went out and those workers had to have a factory and a company that would manufacture something else that's in, it's the same in government.
As healthcare facilities were amalgamated, ONA fought for and won the right to keep those nurses as ONA members. The layoffs of the 90s meant fewer members and less revenue. In response, ONA reorganized internally, turning into a leaner, team-based organization. In 1998, one nurse found out just how important it is to have a strong union. An infant died while in the care of nurse Gita Proudman, and she was charged with murder. ONA's Legal Expenses Assistance Plan paid for her defense, and Gita was set free.
I can't say enough about ONA's treatment of all of us. They were just phenomenal. They just knew that there was something wrong, and I didn't have to prove anything to them for them to do what they did. And that's just amazing. You couldn't ask for anything more. You really couldn't. I wasn't even asking for what I got. It was just offered. It was just offered, and that's the kind of union that they are. That's the kind of group of people that they are.
As the decade ended, ONA continued to work with the Ontario Health Coalition to save Medicare from privatization.
Access to Medicare is everyone's right. Help save our public Medicare system.
In 2000, ONA members voted to join the Canadian Federation of Nurses Unions, and ONA automatically became an affiliate of the Canadian Labour Congress. ONA pushed the Ontario government to hire more nurses. The government finally agreed, but did not act. ONA continued to pressure the government to deal with the nursing shortage. When SARS came to Ontario in 2003, it hit a severely depleted and demoralized healthcare system. As always, the nurses were on the front lines. They paid a terrible price.
Tragically, 2 nurses died after contracting the infection while caring for patients with SARS. Nelia La Rosa was an orthopedic nurse at North York General Hospital. She was Canada's first healthcare worker to die from SARS. 15 other nurses from her unit were also infected with SARS. Tekla Lin, who had more than 35 years of nursing experience, was among the first nurses who volunteered to work on a SARS unit at West Park Lodge, where 14 infected healthcare workers were transferred. The loss of these 2 courageous nurses is a tragedy that must never be repeated.
During the SARS crisis, ONA led the way in demanding protection for nurses and the public. Nurses were recognized as heroes. The public understood that nurses are the backbone of the healthcare system. SARS was the impetus for ONA's decision to take their nursing advocacy efforts even more public. ONA made the conscious decision to form coalitions with other healthcare unions, take a higher profile position in the media, and target governments with nursing issues. In 2004, ONA delegates voted to join the Ontario Federation of Labour. Within the labour movement, ONA has worked to educate other workers about nurses' issues and gain support for ONA's campaigns.
Our decision to affiliate with the OFL, the CLC, and the CFNU was kind of a grassroots initiative that had been underground for a number of years. But when SARS hit and we recognized the importance of having other allies who were being affected by this crisis as much as our members were, that we needed to work collectively together. And the broader voice gave us more information and more support in bringing our issues forward to government.
One of ONA's labour coalitions demanded that N95 respirators be stockpiled so that no registered nurse would ever be exposed to a serious infectious disease like SARS again. And it sought action for the prevention of needle stick injuries. The coalition, through 4 years of hard efforts such as press conferences, rallies and ad campaigns, prompted the Ontario government to pass a regulation requiring healthcare facilities to use safety-engineered devices. The government also announced it would stockpile 55 million N95 respirators in preparation for future outbreaks.
Our allies look to us because we are the voice, and they look to us because they know that we are well respected by the government. And so it's also to their benefit to have that respected voice for them.
By 2005, ONA members endorsed spending $2 million to launch an expanded campaign on the nursing shortage. The union's most ambitious campaign ever, the Still Not Enough Nurses campaign, used print, television and radio advertising, as well as an ambitious media relations plan to educate Ontarians and pressure the government to hire more nurses.
Ontario has a nursing shortage that is becoming a healthcare crisis. Registered nurses are caring for more people and dealing with more severe illnesses than ever before. That has led to stress, injury, and burnout, putting quality patient care at risk. Up to 30,000 nurses are expected to leave the profession by 2008. Leaving you to wonder, when you need a nurse, will there be one there for you? A message from the Ontario Nurses Association.